Patient Planning Services. The social enterprise of cancer support community works with patients, healthcare providers, and community organizations to provide distress screening and other assessments on a digital platform. Our screeners allow for both dynamic and static resource allocation in real time and a triage of high acuity patients while meeting accreditation standards. Kate O'Reilly has worked for PPS for 6 years. Kate holds a master's in social work and has worked globally in Africa, Europe, Mexico, and the U.S. in capacity as a social worker with the pediatric, adult, and geriatric populations. She also has worked in upper retail management in a marketing capacity for a number of years. Kate is originally from South Africa, but now lives in San Diego, California with her husband and 3 children. Damian Piccolo has worked at PPS for 8 years as Chief Technology Officer. He's focused on the intersection of business processes and information systems and enjoys exploring how to optimize technology-enabled experiences for end users. He has a master's degree in Information Systems Engineering from the UTN University at Corbata, with expertise in web and mobile application development, and earned his MBA from Wheeling Jesuit University. Damian was born and raised in Argentina and currently lives in Northern Virginia with his family just across the Potomac from Washington, D.C. Peyton Loniger has worked with PPS for over 4 years and was recently promoted to lead project manager. He's focused on customizing our software tools to meet clients' specific needs and kickstarts product development. He also works in customer service and resolution. He studied business and media at Indiana University, where he earned his bachelor's degree, and now resides in Denver, Colorado, where he enjoys everything the mountains have to offer. Victoria Gerst started working for PPS as an intern in 2022. She graduated with a major in public health science from the University of Maryland, College Park. She has since focused on marketing strategies and administrative support for PPS. Victoria looks forward to earning her master's degree in public health science in the coming years. Suicide rates are 85% higher in those with cancer than the general population. Cancer patients are experiencing increased numbers of depression and anxiety, prompting the need for intervention. In a study observing 465,000 cancer patients across 26 cancer types, treatments involving surgery, radiation, and chemotherapy were found to be the biggest risk factor for a mental health disorder. Mental health illness in cancer patients drastically increases suicide rates. These statistics, as well as the immense cost of care for patients with mental illness, only quantify the need for proper intervention and mental health screening. With early screening measures, the negative mental health impacts of a cancer diagnosis can be mitigated or at least properly addressed. The MyCareReport platform allows for multiple screeners to be launched and administered through one platform. Through the tool, screeners can be launched anywhere from the hospital, in the office, or at home. The versatility of the platform promotes dynamic and efficient usage for both patient and provider. The proprietary validated oncology screener for patients and caregivers is called Cancer Support Source. Cancer Support Source, or CSS, is a reliable, valid, multidimensional distress screening program with the capacity to identify those at risk for significant anxiety and depression. The tool demonstrates strong internal consistency reliability and test-retest reliability, a factor structure that is replicable, and adequate convergent and divergent validity. Additionally, the depression and anxiety risk scales demonstrates high sensitivity coupled with adequate specificity. Our results support that CSS is a relatively brief but multidimensional tool which can assist providers in developing a personalized, integrated care plan. The screener is initiated when the patient or caregiver starts the screener at the facility on web-enabled tablets or computers. The screens are prescriptive, so they can be scheduled ahead of time. The patient or caregiver answers the brief screener, taking approximately 5 to 10 minutes, and clicks Submit once completed. Once completed, a custom patient or caregiver resource report is generated based on the answers to the screen. This can be printed out, emailed, or both. Questions and resources may be customized at the facility's discretion and can include any local and national resources. A clinical provider report is generated to provide a real-time snapshot of patient or caregiver levels of distress, whether they triggered risk for clinical depression or anxiety, and to identify the largest concerns. A one-page immediate PDF of the patient's distress level, as well as the comparison to the previous screen, is generated for the hospital's use. Patients who trigger risk for depression through the screener will have an immediate alert sent to the appropriate staff. Lastly, referrals are automatically dispatched on a per-question basis to departments, individuals, or outside agencies as prescribed by hospital needs. The referral status is available on the dashboard to determine what has been resolved and by whom. Cancer Support Source provides the patient with a personal support care plan with information and referrals for support services which can be emailed or printed. Providers receive a patient distress management report. It's a summary score of patients' results, including actionable clinical alerts to help staff triage a response. Cancer Support Source is HIPAA compliant and can be linked to the EHR using HL7 and Web Services interface. The gaps in mental health screening for pediatrics in an outpatient setting prompted the development of a unique pediatric distress screener. Developed by researchers in the Pediatric Oncology branch of the National Cancer Institute, National Institute of Mental Health, and technology through patient planning services and cancer support community, Checking In is an evidence-informed digital distress screening solution for pediatrics. The evidence-informed tool is a web-based distress screening measure for patients age 8 to 21 with chronic medical conditions and their parents. The tool is currently available in English and is designed to provide real-time results to clinical providers on patient distress and how parents perceive their child's distress. Provider feedback. 56% changed care for the patient based on the screener results. 84% had additional discussions with the patient and parent. 13% made additional referrals they were not previously planning. And 11% received help in other areas like changing medication options and restarting medication. A versatile and customizable platform has allowed development of both proprietary tools in oncology, HIV, and pediatrics, along with open source options that address other issues like postpartum depression and PTSD assessments, to name a few. Although our reach has helped a range of patients, Patient Planning Services committed to creating the best care for the most amount of people. There are several future opportunities for the platform, particularly in developing custom surveys for population health, identifying additional healthcare disparities, suicide prevention, home health, diabetes, behavioral health, and much more. The success of our current platform provides the utmost motivation to bring those new projects and pilots into fruition. PPS is also excited to be embarking on a multi-year joint project with the National Rural Oncology Coalition to bring distress screening and other CSC services to underserved rural communities and critical access hospitals. Patient Planning Services is dedicated to increasing our reach and impact in as many hospitals and organizations as possible. We continue to believe we are delivering the best patient and provider experience for distress screening and are able to identify patients with high acuity needs related to depression and anxiety. Having network partners with ties to various local hospitals provides a direct opportunity for us to demonstrate the platform that can be used in several different hospital departments, now including oncology, behavioral health, and OBGYN. We are more than happy to meet with a network partner virtually to co-present our combined offerings. PPS will take the lead from the network partners who have established relationships and history with their local hospitals and understand the landscape. Our demos allow for hospital administrators and stakeholders to gain an understanding of how the tool works, why it's important, and most importantly, how it can be used and easily implemented in the hospital. We also solve accreditation standards for the hospital and provide a better quality intervention with the platform because of real-time connection to resources and support. Thank you for taking the time to learn about Patient Planning Services and the tool we have created to address the psychosocial needs of different population groups in healthcare.